Welcome to The Hill's Coronavirus Report. I'm Steve Clemons, editor-at-large of The Hill. Each day, we are interviewing consequential leaders in the battle against the coronavirus. There's a saying that while you may not know it, public health saved your life today. There's a mostly hidden infrastructure of health standards, health practitioners, hygiene, and more that gets rolled up together and is called public health. But that infrastructure is not hidden now. We see the value of public health practitioners every day. And one person on the front lines of public health advocacy is Georges Benjamin, Executive Director of the American Public Health Association. He's been on call for the White House during this pandemic while serving as one of 20 members of the Standing Committee on Emerging Infectious Diseases and 21st Century Threats. He can also help us understand what is going well and what is not going well in America's health equation today. Georges, thanks so much for joining me on this. And let me just start out right now. You and I have talked over many years about the public health infrastructure and how unevenly it hits our communities. Some are protected in good shape and others simply are not. And I want to give you this opening opportunity to tell us where we are failing right now when it comes to the provision of public health in our society.
Well, we continue to throw a lot of money into the system when something bad like this happens. And then as soon as it goes away, we allow the infrastructure to go away. And by that, I mean the funding that pays for the staff that are the basic disease detectives that track diseases like this, the technology that we need to allow us to do our jobs. And, it's the challenge is that it's important work. It keeps us safe. Mostly it's on prevention. But some of the things we're seeing right now is the fact that we have not had a robust public health infrastructure in our nation for many, many years.
Can you describe for our audience what are the things that go into a public health infrastructure?
Happy to do so. So we have people that follow data. So they look at hospital data and see that there's so many sick people that are happening in a community that you weren't expecting, and then they go into that community and try to figure out why that is. Then once they know, they come up with measures to prevent it. So let's say you had a bunch of kids who had asthma around the community that wasn't expected. They would go in and try to figure out why those kids had asthma. And they would talk to their teachers. They would look at their house. They would go to the daycare. And this say, for example, you had a bunch of kids that showed up in an emergency department with asthma attacks, and they did their investigation, and all of a sudden they discovered that the bus, the tailpipe was broken tailpipe, noxic fumes, more asthma. And of course, the solution isn't a medical solution. The solution is to fix the tailpipe. So they do those kinds of things. Making sure you wear your seatbelt because there are too many car crashes and people getting hurt in car crashes. Too many people getting sick from a restaurant on a particular day. They go into the restaurant and do an inspection and then make the restaurant, fix up whatever was causing that infection. Those are the kinds of things that public health do every day. And quite often, we don't even know they're doing it.
So thank you for that. When it comes to the coronavirus and the spread of this kind of now global pandemic, what could we have had in place better than we have now to have forestalled some of the spread of this?
Well, we've had these plans to deal with a pandemic, although we were looking at a different disease for over 30 years. And the fact of the matter is that once we had the test, if we had to have that diagnostic test to help it make it work, so we could actually figure out who has a disease, that was one of the failures we had. And then having enough disease detectives on the ground to track people who then turned out to have the disease and look at all their contacts. By the way, we still don't have that in place.
Wait, let me just stop you there. You're saying, the Executive Director of the American Public Health Association, we do not have a tracking system in place now? I mean, there's one thing to test, but once we know, we don't have tracking system in place.
We don't have enough people to do all the tracking that's necessary for a disease of this scope.
What should we do about it?
We need to rapidly begin training people, more people. There's an estimate that came out a couple of weeks ago about over 100,000 more people are needed to help us do this kind of tracking. But more importantly, we actually need a test that's timely and works. Without a test that's timely and works, you don't have anybody to track. You don't know what to track. You're simply tracking people that have been in the hospital and guessing about who they've contacted.
So I know you deal with the White House, you're on these commissions, and you engage with this community of public health experts in and around this problem. And I think one of the big issues that's been coming up is what's happened since February. The president talks a lot about January, but what's been happening since February?
Yeah.
Has your organization been pushing for this large cohort of people? Has it been pushing for a better testing framework than we have today? And what is your optimism or pessimism about whether we're going to actually get that?
So we recognize that the first two tools that we have is good public education about what the risks are, and for us to physically distance from one another. And the second thing, of course, is for us to get the testing out. And we've been actively pushing the government to get the test out and to get a better risk communication method out to people so that we can physically distance. The second thing we've been encouraging, of course, is the research to do a vaccine and funding for the research to do a vaccine, as well as to come up with some good antiviral agents, some pills that people can take that you can treat the virus with. As you know, both of those efforts are underway, but they're going to take some time. I think the other thing we've been trying to do that I think is very, very important is we've been trying to make sure that people understand what the course of this disease is going to be as we've learned more, and recognizing that we don't have all the answers right now, but we will know a lot of it over time, and not to be discouraged if the answers change because the science gets a better understanding of this new virus, which we've never, ever, ever seen before.
I know you have a large network of public health organizations around the United States that are part of your organization. And we're seeing data coming in looking like much of the United States has gotten over the so-called peak, that we see the number of hospitalizations declining and the need for ventilators in many of these key places lessening. I'm interested in what you see in that data and whether we see a false spring, if you will, in it, and what your concerns are.
Well, first of all, I want to point out that it's a mixed picture. Yes, we're seeing a lot of and hearing a lot from those big urban settings that we're seeing on TV every day and are able to actively communicate what's happening in those communities. We're not hearing about all of the problems that we're having in rural America yet, and we're not certainly hearing from all communities. So the challenge we have is that each community is at a very different state in the development of this disease. The second thing I think is important is that while we're winning, but we're winning because we're staying away from one another. And now, of course, we're having a big debate about when do we return our communities back to kind of normal. And our biggest concern is that we try to do that too soon and too fast.
Well, I think one of the questions, I had Mark Dybel on the other day for this discussion. He said, look, our testing numbers are false. We don't have a real read on the number of infected people in the United States because, testing has been so hard to get. And so the numbers are likely much, much larger. And so I guess the question is, if you're reopening businesses and assembly lines and manufacturing plants and other facilities out there, how do you do it without having an antibody test? How do you do it without testing the well? I mean, right now we're looking for, I know people that have been trying to go get tests and they've got to show very demonstrable symptoms, which seems to run right into the face the fact that so much of the disease spread is from asymptomatic people. So should I be really worried about that, I guess? Can you make me feel better?
Without the test, any other data we get gives us a false sense of security. We have to have a test to understand who's been infected, and if I get sick tomorrow, whether or not I am infected from the disease. We have certainly got some tests out there, but we absolutely don't have enough of them for the honest assurity that we can give the public that it's safe to return back to normal.
I'm sure you saw the other day that Anthony Fauci had said they'd been approached by members of the Congressional Black Caucus about the very, very high level of impact and mortality and infection rates among Black Americans. And he said that they were going to try to go to where people were, that they were going to try to direct resources to solve this. I'd like to get your take of this because I know that you have raised this question about communities of color and what I would call systemic racism in the United States that this crisis is revealing, and what can really be done in this.
Well, the first thing we need to do is make sure that communities of color, like all communities, get the right information. And unfortunately, there's a lot of misinformation that people are getting right now. And so we need to make sure that we get the right information to people about how you get the disease and how to protect yourself. The second thing that we absolutely have to do is recognize that many people of color are in those public facing jobs: bus drivers, security guards, working in grocery stores. Certainly not only communities of color, but all those people in those occupations which are higher risk. We need to make sure they understand how to protect themselves. And those of us who then leave our homes to go shopping and do other things with those essential workers need to make sure that we're doing what we can to protect them from us.
What are some of the examples of misinformation out there? I was very taken by what you just said. What are some of the ways that this is being discussed in communities that are not being reached by shows like this or others? What's the story out there about how this spreads?
Well, the first one was several weeks ago that African Americans were immune from the disease, which of course is not true. A misunderstanding about what happens when we say, well, if you're older and you have a bunch of chronic diseases, you're much more likely to get sicker and die. People heard that as, boy, if I'm young and don't have those diseases, I'm also not going to get sick, which of course is also not true. And I think we've heard all kinds of crazy myths about diets and drinking hot water. And because people say, well, the virus doesn't live in the heat. Of course, that's not true as well. And so people are doing, home remedies that they think might help them and save their lives. Drinking more vitamin C, doing these kinds of things. Vitamin C is great for you. It's great for your health, but it's not going to impact the course of this disease.
President Trump has gone after the World Health Organization and said it made so many mistakes on the front end of this crisis that it doesn't deserve our funding, pending a review. Many other critics have come out and said this is not the time to defund the WHO. This is the time to strengthen it, make sure it's active. I'd love to get, as a public health official who's out there, I'm sure, interacting with these organizations, not only here, but internationally, what's your take on the WHO and its status?
We strongly support the World Health Organization. The World Health Organization is doing the best they can with the resources that they have. There may be some things that nobody does any of these kind of emergencies perfectly. But I got to tell you, we also screwed things up very early on. And so we should not do that to the World Health Organization. And by the way, the World Health Organization is there to help many, many nations that can't help themselves without their help. If we pull funding from that now, we think it'll be a crime against humanity because so many people in those communities will die without our help and without our funding.
Just in our last minute or so, Georges, I'd love to hear from you about how you would approach this challenge. Susan Glasser wrote, here in the United States, as hard to believe as it is, frontline health workers, people on the front line of public health, helping folks that are ill, had to wear garbage bags to protect themselves because they didn't have the personal protection equipment that was needed, that was out there. And I'd love you to just kind of, for our viewing audience, to help us break this down. Are we still in that situation today? Has there been a ramp up in PPE, the personal protective equipment that is out there? And are you confident that we've solved this and gotten around the corner of this incredible, what I would call travesty?
We should pretend that we are back in January when this first thing happened, and we should do now what we should have done back in January. We need to make sure that we have an adequate testing system and a great test to test who has the disease and who had the disease before. We ought to have an organized effort to make sure that all of our frontline healthcare workers get all of the protection gear that they need. We need to make sure that we actually communicate to the public what we know, what we don't know, so we can build trust in this response. And then we need to begin right now preparing for the rest of this year because even if this disease is markedly reduced in the next few weeks, we've got to worry about it coming back next fall or winter.
Well, we'll leave it there. Georges Benjamin, Executive Director of the American Public Health Association, thank you so much for joining us today. And thank you to all of you for joining us for the Coronavirus Report. We will see you tomorrow. Stay well.